we've got virtual reality simulators and haptic simulators. So those are ones that may not look like a patient, but can reenact specific procedures and give the learner a feel of doing a specific surgical procedure. We've got simulators like the one here, or we call human patient simulators, that are a close approximation to an infant or an adult. And these will reenact typical physiology. So what this can do is I can put my stethoscope on this simulator and listen to the heart rate, listen to the breathing pattern, and start making diagnoses. It also can simulate for me cyanosis, which means somebody's oxygen is inadequate, and give those cues to the learner that the patient is not receiving enough oxygen, and thus, hopefully, they will perceive that as needing to provide that therapy to them. So really, the purpose of the simulators is to try to make the environment here, the synthetic learning environment, as real or as much like the healthcare setting. So they're really here to give cues to the learner of what they should be doing next, and for us to be sure that the learner is taking that information and processing it as a healthcare provider and making those decisions.